Dr. Daniel Laroche is a glaucoma specialist from New York who sat down with me to discuss why glaucoma impacts the Black community more than any other group. Both slavery and white nationalism play into this, and Dr. Laroche has practical advice for how to combat vision issues. Let's go. Dr. Laroche, thanks so much for joining us today on Pod Save the People.
Thank you. It's a pleasure to be here.
So, I was excited to have you because I've always been interested about teeth and eyes, two parts of the health conversation that I feel like, we don't talk about enough. And because you specialize on glaucoma, I was like, you know what? I just have a lot of questions. So, I'm excited for you to be here. Can you start by telling us, how did you get to eyes? Like, how did you get to glaucoma as the thing that you specialize in? I'm fascinated with that.
When I was in medical school, I was doing a variety of rotations during my third-year clinicals, internal medicine, surgery, psychiatry, and I liked the surgical aspect of it. I thought about general surgery training, but some of that training was a bit brutal, it was a bit militaristic during that training period. And I stumbled upon ophthalmology, which is surgery of the eyes, when I did a rotation. And frankly, before that, I wasn't even aware of the specialty as much. I was very fascinated that during the specialty, when I was seeing patients, you can look inside the eye and see various disease processes like hypertension, diabetes, glaucoma. You can see how the disease affects the person by looking inside their eye. And at the same time, you can go to the operating room and operate to restore vision, to take out a cataract to restore vision, to create a new drain to treat glaucoma, and do lasers for diabetic retinopathy. And so I found that combination of treating patients in the office medically and being able to go to the operating room and doing surgery was fascinating. I fell in love with the profession and I never looked back. Now, why did I go into glaucoma? When I went into my ophthalmology residency at Howard University in Washington, D.C., I saw that a leading cause of blindness at Howard University, particularly in the Black community, was glaucoma. And I saw so many people going blind from glaucoma and being afflicted with this within our communities that I wanted to make a difference, and I wanted to specialize in this and see if I could, do something to help address this, help prevent blindness, and try to really make a difference in this particular specialty because it affects our community so much. Glaucoma affects the African-American community in terms of rates of blindness about 7 to 15 times higher depending on where you are on the planet. That led to my interest in specializing in glaucoma.
Let's sort of zoom out for a second. Can you explain to people what is glaucoma and how glaucoma is not the same thing as cataracts, right? I think they're two different things, but since you're here, I might as well just ask.
Yes. A cataract is when the lens in the eye becomes opacified and blocks your vision. That usually occurs as part of aging and usually starts around age 50. Like when your hair becomes gray, the lens in the eye becomes yellow. So it's a natural part of the aging process that occurs. And so when it becomes very cloudy, we can do surgery to remove the lens, place an intraocular lens in your eye to restore vision. So that's a reversible cause of blindness. Cataract surgery is one of the most successful surgeries that we do in the United States. We do it in a hospital on an outpatient basis where you go into the hospital for a couple hours. The procedure takes about 15 minutes, and you go home. Now, glaucoma, that's a leading cause of irreversible blindness, where that can lead to permanent damage inside the eye. Now, when you touch your eyeball, you have a normal eye pressure, usually around 15. That's the mean normal intraocular pressure. But with glaucoma, the eye pressure goes up to about 18, 19, 20. And when that pressure goes up, damage starts to occur to the nerve that connects the eye to the brain. Okay, and that's called the optic nerve. And when that nerve gets damaged, you can have permanent loss of vision. Unfortunately, you don't feel that. So you have to get your eyes checked for glaucoma because you don't feel that slow elevation of pressure in the eye. And nowadays, we recommend everyone gets checked, particularly when you're over the age of 40 to 50 years of age, to get your eye pressure checked, get your lens checked, get your vision checked. So we can check to see if there's any damage to the optic nerve, check the retina to make sure the retina is okay as well. What causes glaucoma? Well, the lens I was telling you about, in some people, the lens gets too large for the eye. The lens grows with age by about 20 to 30%. And the people with glaucoma, the lens grows a little bit more, like towards the 30% side. And that starts to narrow the drainage angle, rub up against the iris and cause pigment liberation that blocks the drain and cause elevation of eye pressure. In the past, I used to treat that with eye drops to lower the pressure or early laser treatment to lower the pressure. But we've noticed over the years, studies have come out that despite drops and laser, people still tend to get worse with glaucoma. And so to really treat and stop the vision loss that occurs, we have to take this large lens out by doing early cataract surgery and a small microsurgical procedure called trabecular bypass to restore the outflow to the drain. By doing that earlier, we can bend the course of blindness in patients and actually improve vision, because once we take the cloudy lens out, we put a nice new clear implant in, and sometimes a multifocal implant so people can read without glasses and see without glasses. And that's making a huge difference to really bending the curve of blindness in glaucoma.
Why are the racial disparities present with regard to glaucoma? Is it that because you said you can't feel it, so like if you don't go to the doctor, you won't even know this is really happening to you until it's too late? Is it because black people get their eyes checked up like later or less frequently, or is it like where black people live? Is it diet? I don't know. Like, why do we know why the racial disparities are present?
You know, that was a question that really also stimulated me to go into glaucoma. Like, why is our community having such high rates of blindness from this? And having, practiced this over the last 25 years in New York City, having traveled to the Caribbean, having traveled to many countries in Africa, and examining patients and trying to better understand this, the main reason that I find that blacks have higher rates of blindness from glaucoma are for like two major reasons. One, in all these places that I've spoken to you about, the United States, the Caribbean, Africa, blacks have been victimized by slavery, Jim Crow, colonialism, and their segregation. For decades and decades, Caucasians have been able to go to medical school, and blacks were not allowed to go to medical school. Only recently have blacks have been able to go into medical school. So, for example, in the United States, there are 40 million blacks in the United States, but there's only 400 black eye specialists like myself. There are about 26,000 other eye specialists, and they practice mostly in white areas. In all the black communities you go to across the United States, there's very few black eye doctors in the communities to provide access to care and education to the community about glaucoma. And this doesn't just apply to my specialty, but this applies to all other medical specialties. And that's why you see higher death rates of 2 to 4 times from COVID-19, in large part due to lack of access to health care and due to the high prevalence of comorbidities due to the lack of access to healthcare providers. So we have to train a lot more black doctors to take care of the patients in the communities. And that's just not in the United States, but also in the Caribbean, where, like in Haiti, for example, with a population of 9 million, there's only 50 ophthalmologists and only about 15 of them actually operate.
Really?
Yeah. In Africa and Ghana, the ratio of ophthalmologists to the population is about almost 1 to a million. So there's a huge shortage of eye doctors. This whole concept of white supremacy and colonization and all that stuff has really set us back by a long time. It's quite ironic because the first physician was an African named Imhotep from about 3000 BC. And cataract surgery was initially developed in the Nile Valley by Africans with a technique called couching that's still performed today in remote areas in Africa, where they take a copper needle and insert it inside the eye and dislodge the lens into the vitreous cavity to restore vision. This technique is an old technique that has a lot more complications than the newer techniques that we have today, but still, that was something that they had back then, back in like 2500 BC. So we have to train a lot more black doctors. We have to educate the community a lot more as well. That's the main reason. And then also the other reason is that we don't do early enough surgery. The standard of care is using eye drops and laser, and we know over time these eye drops are very expensive. They can be anywhere from $30 to $50 per bottle for one eye drop, and some patients may need 3 or 4 eye drops. And because of the economic differences in the community, the average net worth of a white family is about $171,000. Average net worth of a black family is about $17,000. Now, when people are trying to pay for food, housing, and then all of a sudden you need expensive eye drops, a lot of people in our community can't afford some of these eye drops. And then they have a hard time putting it in their eyes. And we know compliance is poor when you're taking 2 or 3 eye drops. And we're not doing surgery early enough. We need to do earlier cataract surgery, earlier trabecular bypass surgery to help preserve vision. And so that's one of the things that I try to do when I teach my residents and student doctors, to try to become an excellent surgeon, to get excellent surgical outcomes. Because with the newer, safer cataract surgery techniques that we have, and trabecular bypass techniques, the complications are far fewer than they were 25, 30 years ago. We can actually improve vision, lower the pressure, and when we do the surgery early enough, we can get 80% of people off of eye drops and really bend the curve of blindness.
Have you seen anything about eye health with COVID? I have to imagine people are probably visiting the eye doctors even less now. Is there any COVID impact on eye health?
Yeah, there's a tremendous amount of impact on eye health. When we had to shut down in New York, eye doctors had to shut down too. And we could just do virtual visits because we work in very close proximity with patients. And so there's a higher risk of transmission. So many patients were delaying their care to the eye doctor. And because of that delayed care, sometimes some people progressed with their glaucoma if they couldn't get access to medications or if their glaucoma got out of hand. The good thing is that now that we're back open, we have all kinds of COVID-19 protocols with plexiglass, masking, hand washing, and hygiene and deep cleaning, social distancing and spacing. So the risk of transmission is very low in the office now, extremely low. So people should go out to their eye doctors and get their eye exams and their routine examinations to make sure that they're not losing vision and to keep on top of their eyes. And now we have the vaccine that's out, so I do encourage everyone in the community to get the vaccine. I got my shot. My first one, I'm due for my second one tomorrow. And so I do encourage people to, make arrangements to get that because blacks are being affected at 2 to 4 times higher rates than whites with COVID-19. But whites are getting vaccinated at about 2 to 4 times higher than the rates of blacks. And we want to, bridge that gap because we are at high risk because we tend to be on the first line and front lines as essential workers. And also we have a higher rate of comorbidities, so that contributes to a higher death rate.
We should get our eyes checked twice a year?
Once a year.
Once a year?
Yeah, once a year is fine. When you get closer to age 40, one, you may start to need reading glasses or computer glasses because presbyopia develops where the lens doesn't focus as well. 2, you want to get your eye pressure checked to make sure eye pressure is okay, which the mean normal is about 15. You want to get your visual acuity checked to see if you need any glasses. Get your optic nerve checked, the retina checked to make sure you have no retinopathy. We have a high rate of obesity in the community and hypertension, and sometimes that can lead to retinopathy, hypertensive retinopathy, diabetic retinopathy that can lead to loss of vision. You want to get checked for that. The best medicine is healthy food. Lots of salads, lots of vegetables, baked chicken, baked fish that will keep you healthy. Try to stay away from too much rice, too much bread. Try to exercise 30 to 60 minutes a day, walking, running to stay healthy, to avoid diabetes, avoid obesity, avoid high blood pressure. Those will all protect your eyes as well. But getting your eyes checked once a year. Now, if they pick something up like glaucoma or cataracts or diabetic retinopathy or something like that, then you may need to see an eye doctor more often, like every 6 months or 4 months or 3 months, depending on what's going on.
Got it. Now, if you had a magic wand, what would you fix about Eyecare Health in the United States? Would it be insurance that you'd fix? You already talked about that we would equitably distribute eye doctors and eye care practices much more. What's the fix? What should we do better as a country that we haven't done well?
I got a list of things. First, we have to have a universal healthcare system so everybody has access to healthcare. Right now, we don't have a universal healthcare system. We have many people that are uninsured and don't get access to healthcare, so we have to have a universal healthcare system. 2, we have to eliminate structural race-based plantation capitalism and structural poverty. And that affects many different things, like in housing, education, criminal justice, healthcare, workforce. This leads to adverse outcomes. And we also have to address the wealth gap. Like I mentioned before, the average net worth of a white family is about $171,000 compared to $17,000 of a black family. And that gap is a big reason for lack of access to health care and affordability of health care. Some of the steps we can do to take that, they're working on this now, is increasing the minimum wage to about $15 an hour. That helps to provide a living income and stipend to poor people. For those people that are unemployed, perhaps they can get a minimum type of stipend of $7 an hour so they can have access to food, okay, to reduce malnutrition and poor health outcomes from that. Right now, as you can see politically, one of the biggest issues in America is domestic white terrorism also. So this domestic white terrorism causes a lot of stress to all Americans. We've been experiencing domestic white terrorism for decades, but now that the domestic white terrorists are going to the Capitol, it's making the news every day. So that causes a lot of stress. It can lead to blood pressure, diabetes, retinopathy, strokes in the eye, and things of that nature. The government spends billions of dollars on research. All these medical schools and medical institutions and educational institutions get billions of dollars on research, okay? But that's not tied to diversity, okay? That's not tied to the amount of black researchers that are there or black people getting mentored to become future researchers. And we have to relook at that and tie that to diversity because we have 40 million black Americans here who are also taxpayers that pay into this, and they don't receive their fair share of research funding, research training, and research development. And the same thing with the medical corporations. All the medical corporations, corporations on Wall Street, making billions of dollars on drugs, medical devices, things that Americans use all the time. But there's a complete lack of diversity at the executive level and each of the levels coming down. And we have to make sure that corporate America takes a look at themselves and their leadership, okay, to make sure they're diverse and reflect the fabric of America. We have to work to increase the number of black and Afro-Latino physicians. Right now we make up about 13% of the population, but we only make up about 4% of physicians. And my specialty of ophthalmology, we only make up about 1% of ophthalmologists as well. These are some of the things that I think we need to do to help bridge the gap overall if I had a magic wand.
And are there any other eye-related things that we should talk about that we don't, that like we're not even considering? Is it like, I don't know. I'm sure I know nothing about eye care besides my own. I used to wear contacts for a long time and glasses. I got LASIK a couple of years ago. I don't know. What else should we be talking about that I don't know, that we don't know?
Well, right now we're in a COVID-19 environment, so many people are at home on their computers. Those people that are spending a lot of time on the computers, you want to make sure you get an eye exam so you have the appropriate spectacle correction and you can see okay and see the computer clearly. When you are seeing the computer, you want to do the 20-20-20 rule. After you look at the computer for 20 minutes, take a 20-second break and look at something 20 feet away to give your eyes a rest to reduce the strain on your eye. That's one. Two, at night, you don't want to spend too much time on the computer or phone because the light from the computer or your phone can disturb your sleep cycle and the melatonin sleep cycle in your body and the hormonal sleep in your body that occurs. Because your body, when it's dark in the room, your body wants to go to sleep and shut down. But when you're looking at your computer, it starts to think it's daytime, and that can change the rhythm, the diurnal rhythm of the night. Most of the diseases usually occur along the elderly range, from cataracts, glaucoma, diabetic retinopathy, in that respect. So getting an eye exam is very important to check for those things. Macular degeneration also in the elderly. So the most important thing is, despite the fact that it's COVID-19, take the proper precautions, keep your appointments with the doctor, wear your mask, do social distancing. Most medical offices are COVID-19 safe. And then if you can't get out, you could do telehealth as well. Most doctors do telehealth appointments over the phone and or by computer, so you can do that as well to take care of yourself. Those are some other tips and pros for you.
Where can people go to stay in touch with you and stay up to date with what you're doing?
On my website, www.advancedeycareNY.com. I have some materials. You can get in touch with me. I have educational videos. Also, on my YouTube page, Daniel Laroche MD, I have educational videos on glaucoma and surgery as well. Our office number in New York is 718-217-0424. We do telehealth consults also. And the Manhattan office, 212-663-0473. And I do encourage people to make sure they take care of their eye health and their systemic body health as well.
Well, we consider you a friend of the pod and can't wait to have you back. So thanks so much.
Hey, DeRay, thank you very much for having me. And I just want to say I appreciate all the work that you do with the protests and educating people and education as well. So, keep up the good work that you're doing.
Well, that's it. Thanks so much for tuning in to Pod Save the People this week. Tell your friends to check it out. Make sure to rate it wherever you get your podcasts, whether it's Apple Podcasts or somewhere else. And we'll see you next week.